today. I am pleased to share with you here Healthy Schools Campaign national policy work on health in mind, improving education through wellness, and we are very excited to get started today. So before we do get started, I'd like to go through a little bit of information. So next slide. Okay, so a little bit about our logistics. Our webinar will run approximately for 1 hour. We actually will stop, we will stop probably exactly on 1 hour. Everyone should know is that there will be a recording available of this webinar. We will make it available within a week on our website, and everyone on this webinar will receive an email with a link to the location of the slides and this audio-video file. Also, there will be a Q&A session. We're going to leave 10 to 15 minutes at the end for questions. So if you do have any questions, please, there is a box for questions. Type your questions in, and we will do our best to get to them at the end in the Q&A session. Finally, when you do leave, there will be a very short, it will take you less than 1 minute to fill it out, but we would really appreciate you taking the time to help us and fill out that very brief survey. So, okay. So, and then we'd also like to say, make sure, be part of the conversation. Besides asking questions, join us on Twitter. Healthy Schools is our Twitter handle. You can also send tweets to Health in Mind. Ask us questions later. Ask our questions today. We'll do our best to get to you, get questions to you on the web, questions answered on the webinar or through social media. So let's get started. First, a little bit about Healthy Schools Campaign, who we are. Healthy Schools Campaign, we are a not-for-profit organization. We're located in Chicago, but we work on local, state, and national levels to promote healthy schools and healthy students. We believe in the simple and common sense notion that healthy students are better learners and that health and wellness should be incorporated into every aspect of the school experience. For the last 10 years, we focus our efforts in Chicago, where we've worked to improve food and fitness environments in public schools. We've been able to change nutrition standards, implement sustainable procurement practices, bring back recess, and engage hundreds of schools in a journey to a healthy school environment. Our programs focus on identifying, supporting agents of change, including parents, teachers, students, principals, and school nurses, and helping them make changes at their schools and their districts. Through this work, we've had the opportunity to see how federal, state, and local decisions impact schools. And in this work, we have come to them the importance of empowering individuals to be change agents, the need for teachers, principals, and other school staff to have knowledge and skill to create conditions for health in the classroom in schools, understanding the role of transparency and accountability that have in encouraging health promotion, health promoting changes and academic excellence, and the importance of school health services, including school nurses and access to mental health services. Through our project, Health in Mind, next slide, promoting education through wellness, we have had the opportunity to bring some of these lessons to the national policy arena, and this is what we're here talking about today. Just so we all know, I want to acknowledge our partners, Trust for America's Health, who worked on this project hand in hand with us, as well as receiving support through the W.K. Kellogg Foundation. Now, our Health in Mind initiative began nearly 2 years ago through a series of national convenings involving over 100 local, state, and national health and education practitioners, policymakers, and researchers, and through that we developed our Health in Mind recommendations. The recommendations of Health in Mind, which came out of this process, focus on the federal agency role. We know that changes need to happen at local levels, but we understand the power of federal policies that can have in driving local change. Now, we have never met a principal, a teacher, or a school administrator or a policymaker who don't understand that health is directly tied to a student's ability to learn. And despite almost universal agreement that health is important, most teachers and principals do not prioritize health because they don't have the necessary knowledge or skills to translate that understanding into their work. Also, because metrics and accountability systems for evaluating schools do not include health and wellness, this becomes a continued challenge. As a result, most school officials aren't able to integrate what they know to be important into their classrooms or schools. Well, thanks to the work of many, including CDC, EPA, USDA, and many of you who are listening today even, There are excellent materials and best practices to guide schools in addressing health. The challenge that we have is how do we motivate school leaders to fully integrate health into education policy and practice. Our experience and research suggests that there are key strategies for this, and they include providing teachers, principals, and other staff with the knowledge, the skills to integrate health into all school policies and practice, and to incorporate health and wellness into measurements, including the school report cards, school improvement plans, and longitudinal data systems. Now, today, we're very excited to say that we have Dr. Charles Basch of Columbia University Teachers College to thank us for helping us better understand the connection between health disparities and the achievement gap. It was his report that over 2 years ago, the report Healthier Students Are Better Learners, that really put us on the path to our recommendations on health in mind. So it was really an important piece of information for us to incorporate how key health is to academic outcomes. His research has identified 7 health conditions for which there are high prevalence and that impact learning, and which can also be successfully addressed in the schools. So, having said that, I would like to introduce Dr. Charles Basch and have him walk us through the basics of his information. Healthier students are better learners. So, Dr. Basch, the floor is yours.
Thank you very much, Mark, and I'm happy to be here. And I appreciate the Healthy Schools campaign hosting the webinar. Trying to see if I have control of my slides, but don't seem to have that at this point, so I need to see if you know what, do that, or I can go forward without the slides.
Or just tell us to move forward, and we'll move the slides for you.
Next.
Okay.
So the basic concept that really underlies the first part of what I'm going to talk about is that no matter how effective teachers teach, no matter how rigorous our curricular may be, how we revise financing or organize schools, or what standards and accountability measures are put in place next, the motivation and ability of students to learn really must be addressed if the benefits of these other school reform efforts are to be realized. And problems I've called educationally relevant health problems or health disparities have powerful but often overlooked effects on teaching and learning. Next. It's pretty clear now that education, an individual's educational level will predict their health, and the opposite is also true, so that there are reciprocal causal relationships between individuals' health, their education, and underlying social and economic conditions. But despite this, the connections between these problems, oftentimes the solutions are implemented in categorical ways along with policies, funding streams, and other attempts to address them, and that doesn't serve children well. Next. The focus I have is really on urban minority youth from low-income families. Clearly there are great needs in rural areas and in suburban areas, but the focus of the work I'm going to talk about is really on the achievement gap, which is mainly affecting urban minority youth that will become the majority segment of the U.S. population very soon. I'm also focusing on school-age youth. That's not to say that children between the ages of birth and 5 years of age would be unimportant. Indeed, they are perhaps the most important segment in terms of when overall development of their academic and social skills is really critical. Unfortunately, in the U.S., we currently don't have sufficient preschool infrastructure to really adequately address those needs. And my scope is also delimited to problems that can, indeed, must be addressed by schools. So next, the first part of my talk will really be on health factors that affect educational outcomes. Next. And in that context, sorry, next, Mark. Next slide. I'm going to begin by talking about just how prevalent these health problems are and the extent of health disparities. I'll talk briefly about the evidence of how and why these health problems affect educational outcomes, and then we'll talk about what schools can do about that. Next. So based on these criteria, these three criteria, I identified these 7 health problems: vision, asthma, teen pregnancy, aggression and violence, physical activity, breakfast, and ADHD, that warrant consideration by people in schools and people who care about the academic and social and overall development of youth. And the problems may vary from one locality to another, and this is not to say that every single site must address all of these things, but these are factors that warrant consideration. And the other very important point that I want to make is, while it's not specifically delineated on this list, the underlying theme of any quality school health program is going to include a strong emphasis on mental health. Next. And mental health is a cause or a consequence of all of these and other problems. Next. All of these health problems are highly prevalent. Vision problems are estimated to affect 20% of youth. Asthma is the most common chronic disease affecting youth. 14% of youth under 18, or about 9.9 million individuals. About almost 1 in 3 teens is expected to become pregnant, despite the fact that we're at the lowest levels of teen pregnancy in many years. Violence is epidemic in the nation's schools. 3 in 10 report being bullied. Physical activity is insufficient. About 1 in 5 skip breakfast, and inattention and hyperactivity is the most common mental and behavioral disorder affecting school-age youth, with about 8% or 4.6 million individuals. Now, all of these problems affect the nation's youth, but have, next slide, disproportionate effects on urban minority youth. And I'd like to go through these slides quickly, but as you look at the rates of visual impairment, next, or as you look at the rates of asthma prevalence, here you see that the rates for blacks are considerably higher than for whites. You see how it's important to disentangle the Latino population, to recognize the differences within that group. And the important thing to mention about asthma is asthma per se is not the problem. It's poorly controlled asthma, and these same levels or greater disparities would exist if we looked at extent of poorly controlled asthma, as indicated by overuse of emergency rooms for routine care and their use of efficacious medications. Next. Rates of teen pregnancy have declined, but we still, these are based on 2006 data, but we still see tremendous disparities. Next. And here we see data from a nationally representative sample of high school students in America based on 2011 data collected by the Centers for Disease Control, and you can see tremendous variations in the extent of students that have been in one or more fights during the past year based on their racial ethnic background. Next. This next area shows the proportion of high school students in America that report missing 1 or more days of school during the last month because they were afraid to be at school or travel to or from school. And these rates are tracked biennially every 2 years and have shown very little changes, so we're really not making sufficient progress here. Next slide. These same disparities exist for participation in physical activity. You can see compared with whites, particularly black females, as well as Hispanic females, are less likely to participate in regular physical activity. Next slide. And we know that breakfast consumption is also not routinely consumed by children in America. It's staggering and incredibly distressing that we have the extent of hunger in America. And it's certainly not realistic to expect children are going to be able to pay attention and learn in school if they show up in the morning on an empty stomach. Next slide. ADHD has also been shown to vary by family status and household income. Next slide. So everything I've talked about up till now is kind of really old news. These disparities and these trends have existed for a long time. And the next area I'm going to talk about is based in research largely from the neurosciences that has been conducted in the last 10 to 15 years. Next slide. So how and why do these health problems affect motivation and ability to learn and ultimately academic and social success in school, high school graduation, college attendance? It's through these 5 causal pathways. Sensory perceptions, in this case being able to see and hear well. Cognition is alertness, memory, thinking ability, learning how to learn. School connectedness and engagement is the extent to which students feel that other students and adults in the school care about them as individuals and learners, and is shown to be quite predictive of academic and social success. And of course, absenteeism is highly predictive of high school graduation and college attendances, even in the elementary school years, has been demonstrated, and is a lot more attention devoted to this now in early warning data systems and so forth. Next slide. So I want to just quickly go through some examples to illustrate how these causal pathways are influenced by multiple health problems. So here we're talking about the extent to which a child can see well. The majority of these problems are due to refractive errors. But if you can't see well, if you can't distinguish P's and D's and B's and Q's, it's obviously going to be much more difficult to learn those decoding skills which are absolutely essential for reading. And children, unfortunately, in many cases receive screening, but they don't receive follow-up care and glasses, and the benefits of screening are compromised. Children with ADHD not only have more vision problems, they have problems with perception of time, which is necessary for solving mathematical problems or writing a story or completing many sequenced tasks that are routinely required in school. Next slide. You can see the cognition, the ability to pay attention and remember things and think and solve problems, is affected by 6 of these 7 problems. Here we're not talking about sensory perception with respect to vision, but rather the connections between your eyes and your brain, being able to see something up on the blackboard, process it, and write it down in your notes. Asthma affects cognition because of children with poorly controlled asthma don't get as much sleep. They have a harder time falling asleep and staying asleep, and sleep has been shown to have powerful effects on memory, alertness, and cognitive processing. We also know that children exposed to aggression and violence, which is pervasive, do not concentrate as well. They have more intrusive thoughts. They have more off-task behavior. They can't really engage and focus in school if they're worried about they might be getting beat up after school and they leave the building. Neuroscientists have also shown how physical activity affects our brain chemistry through the uptake of neuronal factors and oxygen saturation and other powerful chemicals that have an effect on our ability to think and do well in school. And breakfast is known to have, common sense tells us eating a good breakfast is important in our ability to focus attention and stay alert. And there's attention given to that around test-taking times, but it's really essential to eat a good breakfast as part of an everyday habit. And by definition, children with ADHD, next slide, really can't focus their attention. They can't think clearly. They can't sit still and learn things. Now, why is vision problems related to connectedness? Well, think about the child who can't see. No matter how hard they try, they continue to fail. What's the result likely to be? Well, too often I think it's going to be demoralization and disconnection from school, because their efforts not reinforced, and it's not the kind of situation where you want to be. It's the kind of situation you want to get away from. Likewise, it's been shown that children with poorly controlled asthma have more anxiety, more mental and emotional comorbidities that may prevent their ability to connect in school. By definition, if you're attending a school characterized by a lot of bullying and meanness and aggressive talking behavior and physical aggression, it's not going to be the kind of place where you feel like you belong and you want to stay. Physical activity programs provide an opportune moment during the day for teaching about cooperative learning and getting along with others and solving problems and learning how to fail and try again and learning how to succeed and not gloat. But too often these programs are catering to the most athletic children in the school and not really used to their fullest extent to teach young people about important life skills that are going to benefit them in their careers and in their personal lives. And it's tragically sad that children with ADHD, next slide, really don't have friends. They don't get along with adults. They don't get along with children very well, and they're much less likely to graduate from school. Children with asthma are absent more. It's not controversial. This has been shown repeatedly in studies. Children with poorly controlled asthma are absent much more. We showed that on an earlier slide how students in the nation's high schools, 1 in 20 white students, 1 in 10 Hispanic students say they've missed 1 or more days in the last month. That's just in the last month because they were afraid to be at school or travel to or from school, and that has to change. If students are not in school, it's not realistic to expect that they can really fully capitalize on learning opportunities. And physical activity, breakfast, and ADHD have all been shown to be associated with lower levels of absenteeism. Next slide. Finally, teen pregnancy is a powerful predictor of dropping out of school. Young women that become pregnant and have children at a young age are much less likely to finish high school and much less likely to attend college. Having a non-marital teen birth is one of the strongest predictors of living a life in poverty and repeating a cycle of intergenerational poverty. Likewise, children with ADHD are also much less likely to complete high school. Next slide, and attend college. So what can schools do about this? It's not really tremendously complicated, but it does require attention and is feasible to do. Next slide. With respect to vision screening, rather than just conduct the screening, there's a need for more outreach to parents and teachers. There's a need for more on-site provision of services. Just invest the $25 or $30 or $40 it would take per child to do the exam on the spot and provide the glasses, one to keep at school, one to bring home. Otherwise, we're investing a tremendous amount of social resources in screening, and for too many children, they're not getting the educational benefits that can result from it. We also know very well what to do to have an asthma-friendly school, and that involves effective case management to follow up on children with asthma that are absent, making sure that children have asthma management plans on file, making sure that the students are assured that if they do have an attack in the school, there's somebody there and the teacher's going to know what to do and that they're going to be safe. Educating students with asthma, next slide, and providing opportunities for them to participate in physical activity. Teen pregnancy is a tremendously challenging problem, and schools can do a lot to help not only young women, young men as well, to learn how to avoid becoming pregnant as a teen. And unfortunately, if we begin this kind of education in middle school, it's not going to work very well. These kinds of efforts really have to begin in kindergarten. Not that we're talking about sex in the early grades, but rather that we're talking about the kinds of life skills and communication and assertiveness and negotiation and conflict resolution that will help young people make informed decisions that are constructive for their lives rather than self-destructive. And we know these social and emotional learning skills that are applicable to things like teen pregnancy are also relevant for avoiding violence and substance use and many other kinds of decisions that youth face as they transition from childhood to adolescence. For youth who do become pregnant, if they are going to have a hope of finishing high school in a timely way, they will need some services to help them become a parent and finish their work in school. Next slide. Violence, aggression and violence in schools is a urgent national crisis, and it's important that we put it in perspective and recognize that until these issues are really addressed, and we do know how to address them well through these kinds of initiatives, that we are going to really jeopardize the benefits of other things that are being invested in to try to improve the academic performance and life prospects for children through the nation's schools. Next slide. Likewise, with respect to physical activity programs, we know a great deal about how to use such programs to engage young people in school, how to teach them to work together as peers, to help one another, and to learn the kinds of life skills that will really are really essential in competing in our current, not even our future, in our current global economy. Allowing students to eat breakfast in school and eat breakfast in the classroom is another idea that's really been shown to work throughout in cities throughout America. And next slide. There's a need for much more attention to assist children that have issues with respect to paying attention and being hyper. And too often, the results of the efforts focus on controlling symptomology rather than really helping young people develop the academic skills they need and the social skills they need to overcome these challenging symptoms that they have and are having a difficult time regulating. Next slide. So the conclusions seem pretty obvious to me, and I think to many people, and that is, next slide, if a child can't see, it's going to be harder for them to learn how to read and do well in school. Next slide, if they can't get a good night's sleep and come to school in a way where they're able to pay attention, then it's going to be much more challenging. I seem to have went ahead a little bit there, but you can leave it on that slide. I just want to make the point is, if children have these health issues, if they're hungry, if they're upset, if they're worried about getting beat up from school, if they're sedentary and lethargic, if they're distracted, they're not going to be able to be motivated and able to learn. And the important thing to keep in mind, next slide, is that many of the young people are affected by multiple problems simultaneously, and that's why we really need to have a strategic and coordinated effort where a high-quality school health program will address these multiple factors simultaneously. Next slide. So I don't want to say too much more because the things I often talk about from here on in is effective and efficient school programs and how schools can influence the health of youth. I would just close in saying that there's a tremendous amount known about what can be done. There's a need to focus efforts strategically on health problems that have powerful effects on teaching and learning. There's a need to focus on programs that are high quality, and unfortunately in too many instances the programs that are some of the most widely disseminated school health programs in America really don't have sufficient evidence that they're really high quality and have evidence of effectiveness. And then, perhaps most challenging, there's a need for coordination among the different efforts focusing on these different issues and integrating school health into the fundamental mission of the school. And that's going to require dedication of an individual within a school or district to really focus on making the connections. So you realize a health department might conduct a screening, parents might have to take the child for an exam, the teacher might have to help ensure that the child's using their eyeglasses for near or far work as prescribed. But if there's a lack of coordination, even in this one example, it's very easy to see how a child may fall through the cracks and consequently not really be able to learn how to read in a timely way, which will have lifelong consequences. So there's a lot of interest in this topic, and there's a tremendous number of organizations ranging from the highest levels of the United States government, including Secretary of Education and Secretary of Department of Health and Human Services, the American Federation of Teachers, National Educational Association. I can go on and on and on. Nobody really argues with the importance of these issues. Despite that, we still really lack a national strategic plan to address these issues. We really still seem to lack a strong national will to prioritize these issues as part of the fundamental mission of our schools. And if it wasn't enough that these problems are really having devastating effects on academic achievement and educational outcomes among our most vulnerable population of youth in America, but they're furthermore contributing to subsequent healthcare costs that are bankrupting our economy. So the good news is that we have a lot of momentum. Changes are occurring thanks to the groups such as the Healthy Schools Campaign, which in my opinion has probably done more to move this agenda forward than any other single entity in America, and I'm grateful to them and honored to be associated with them. And at this point, I'd like to turn it over to them to talk about the Health in Mind agenda and how you can help. So thank you very much. I appreciate it, and I'll do my best to answer any questions you may have at the end of the webinar.
Great. Thank you so much, Dr. Basch. We really appreciate your time and all the work that you put into this, into these issues. And we, too, look to you as one of our leaders in helping change people's perceptions and understand the importance of student health in schools. So next up, I want to introduce Alex Scheibel. Alex is our policy analyst here at Healthy Schools Campaign, and she has been an integral part of our team in helping do the research and ultimately develop our recommendations with health in mind. So Alex is going to walk through what our recommendations look like. So Alex, please take it away.
Great. Thank you so much, Mark. And thank you to Dr. Basch for doing a wonderful job of laying the foundation for what we really base so much of our health in mind work on. You've been a fantastic partner to work with, and we really appreciate your leadership on this issue. So what I wanted to do is just take the time to go through the recommendations that we outlined in Health in Mind. Through Health in Mind, really, the goal and the challenge of the project was to come up with concrete recommendations that could have a significant and a sustainable impact on the academic achievement gap and then on supporting the health and wellness of students. And we also wanted to set out to find recommendations that were within the current regulatory authority and the budget of the Department of Education and the Department of Health and Human Services. So what we developed through our project was recommendations that fall into the following 5 focus areas. We focused on professional development, metrics and accountability, recognition programs, institutional capacity, and school health. So what I'm going to do now is just take the time to go into a little more detail on each of these issues and then on the recommendations that we developed through Health in Mind. So first, for professional development, this is a picture of our Fit to Learn program, which is a professional development program that we run in Chicago for teachers. And it really focuses on providing teachers with the skills that they need to support health and wellness in the classroom. We've trained over 100 teachers through the program, and through it learned just what wonderful champions teachers can be for promoting health in the schools. And we would really love to see similar programs like this throughout the country. And through Health in Mind, we also discovered that there's really little guidance in terms of what these professional development programs can look like, and also found that less than half of the states in the country have health-related requirements for professional development for teachers and school leaders. The second issue that we focused on was metrics and accountability. And we've found through our work, so for the last 10 years, national education policies really emphasize the need for state and local education agencies to be publicly accountable for tracking school and student performance. And while this has led to a lot of really fantastic changes, a lot of these indicators primarily focus on academics and don't address other factors, including student health, even though many of the lowest performing students experience health-related challenges, as we heard from Dr. Basch. So we found that incorporating metrics into health and wellness into data tracking systems can really provide educators and policymakers and the public with a more complete understanding of how student health and wellness are impacting learning and academic outcomes. And with the hope that this can then help educators make decisions about investing in student health. So as an example, we used the Chicago Public Schools report card, which is pictured on this slide. The report card has an indicator in the upper right corner, which is magnified on the slide, which shows whether or not schools have met the Healthier U.S. School Challenge, which sets high standards for nutrition and physical activity and physical education. And we found this to be a really excellent motivator for getting principals interested in how they could make the changes that were needed to turn red N's into green Y's to indicate that they were healthy schools certified. So our recommendations around professional development and school accountability for Health in Mind really focused on trying to figure out how the Department of Education could incorporate health and wellness into their programs by supporting innovative programs. We asked them to include health and wellness as a competitive priority in a number of their grant programs. And for example, their school improvement grant program. And as I mentioned before, how there's a general lack of guidance about what quality professional development programs that support health and wellness look like and how states can include health and wellness into their school accountability programs. Our second recommendation really focused on that issue and recommending that the Department of Education create guidance documents around these issues. We also looked at recognition programs through Health in Mind. We think recognition programs are a simple and cost-effective way to motivate districts and schools to make the changes that are necessary to support health and wellness. So we recommended that the Department of Education look at incorporating health and wellness into their recognition programs, including the Blue Ribbon Schools program. And we also focused on capacity building and Health in Mind. In Chicago, the district recently appointed a chief health officer who is pictured in this image, Dr. Stephanie White, who has really done a fantastic job of taking leadership on a number of health and wellness initiatives within the district. And the district has also formed a Department of Health and Wellness Promotion, which again has been able to house a lot of initiatives that can support student health and wellness. And we found that having this capacity to support health and wellness within education has had a huge impact on the overall health and wellness environment of schools throughout Chicago. So we recommended that Department of Education look at how they can improve their capacity around school leadership by expanding the Office of Safe and Healthy Students mandate to take a more comprehensive approach to health and wellness and ensure that there's appropriate leadership within the department to make sure that all offices within the Department of Education are thinking about health and wellness. Our final area that we focused on is school health. We feel that schools can be a play a critical role in supporting school health services, both physical health services and mental health services. Not only can schools serve as a venue for delivering those services, but they can also play an important role in terms of connecting students with local providers and making sure that students are getting the services when they need them. There's a lot of research supporting the role, for example, that school nurses play in improving the overall health and wellness of students, improving academic achievement, decreasing rates of absenteeism. So we sought to identify strategies for how federal agencies could do a better job of supporting the delivery of these services in schools. So we specifically connected our recommendations around school health services to our nation's prevention strategy. This strategy recognizes that health and wellness goes beyond the healthcare setting, and that what happens in other institutions, including schools, is critical. The U.S. Department of Health and Human Services is the lead agency in developing the national prevention strategy, so our final set of recommendations was for them. And first, we asked Department of Health and Human Services to reduce current barriers that schools face in receiving reimbursement for the health services that they're delivering, specifically to Medicaid-eligible students. And we also asked that schools are recognized as an eligible community benefit in order to really strengthen the relationship between hospitals and schools, and with the hope that they can work together to better support student health. And finally, we asked Health and Human Services to use the National Prevention Council to explore the full potential that schools can play in health and wellness promotion and really create a new vision for schools' roles. So we had the opportunity to present these recommendations to both Secretary of Education Duncan and Secretary of Health and Human Services Sebelius at an event in May. And in addition, both the presidents of the National Education Association and American Federation of Teachers were there, and they really reinforced the importance of these issues to schools and expressed their support for health and mind and the recommendations. And both Secretary Duncan and Sebelius pledged their support to work with us to make sure that these recommendations were implemented. And so I wanted to just take a couple moments to discuss how we're working with both agencies to ensure that these recommendations are implemented. First, with the Department of Education, as I mentioned, there's a real lack of guidance documents about what best practices are for supporting health and wellness at the district level for colleges and universities that are providing professional development to teachers and principals, and to states that are trying to figure out how they can integrate health and wellness into their accountability systems. So we are in the process of working with the Department of Education to develop those guidance documents. And we're also working with the Department of Education to look at how we can integrate health and wellness into a number of their grant programs. And in addition to looking at how we can include it as a priority in their upcoming proposals, we're also exploring the possibility of providing technical assistance to current grantees to assist them in supporting health and wellness in the programs that they're implementing. And in terms of our recommendations for health and human services, we've been engaging regularly with the Department of Health and Human Services, and we're excited to say that the Surgeon General will be issuing a charge to the National Prevention Council to explore the full potential that schools can play in health and wellness promotion. So addressing one of our key recommendations from Health and Mind, and we're expecting that charge to be issued in May with the hope that it will result in bringing together multiple sectors and agencies from all levels of government to discuss strategies for moving this conversation forward. And Health and Human Services is also looking at how they can address existing barriers to reimbursement from Medicaid, and really increase the resources that are available for school health services to make sure that there are school nurses and mental health service providers in schools and that students have access to those services during the school day. We would encourage all of you to please become involved in our effort. You can download the full report, which has our recommendations, in addition to a number of case studies from across the country, highlighting wonderful, innovative examples of local initiatives and state initiatives to support health and wellness. And you can also visit our website and sign on to our vision statement related to this project. And we will be sure to send you updates related to the project as we continue to move forward with implementing those recommendations. So I'm going to turn it back over to Mark Bishop for questions.
Great. Thank you so much, Alex. Really appreciate that. First, for everyone on the call still, we have about 14 minutes left on the call. And if you have questions, please go to the questions box or the chat box and type in a question, and we will do our best to answer it. And in the meantime, I'm going to get to some questions right now. So let me start with Dr. Basch. So Dr. Basch, you mentioned 7th health indicators. But besides breakfast, you did not mention nutrition. Where do you see nutrition and healthy school food or healthy school lunch play a role in supporting school health?
I think that's a good question, because one thing to keep in mind is that the work that I presented, which is described in greater extent in a research document, is really based on the available research that's been conducted. And the way that work has been conducted has been very narrowly focused on these individual issues, not only within the health field in general, but even within subcategories like the diet and nutrition field. Now, of course, it makes tremendous sense to have a more holistic and health-oriented nutrition policy than only focusing on breakfast. So breakfast is really just a minimal thing and just intended to sensitize about the need for just ensuring that when children come to school in the morning, they are not hungry. It's really directed to the most vulnerable population in our nation's schools. However, of course it makes sense to have a cafeteria with high-quality food, preferably locally sourced food and rich in fruit and vegetables, rather than high-fat, low-quality foods that are high in fat and salt. Of course it makes sense to have school policies that in their vending machines might have options that are fruit and other things rather than candy and soda and junk food. Of course it makes sense to use the food cafeteria as a laboratory for learning important things about how to make informed choices in restaurants and in the foods we eat. So dietary intake is one of the most important health behaviors that affects us, and simply focusing on breakfast is not intended to discount the need for a more holistic and comprehensive approach to addressing it through the nation's schools.
Okay, great. Thank you. So I'm going to follow up. Dr. Basch, let me ask you this. How much do allergies, specifically food allergies, play a detrimental role in education, and do you see that as an issue to be addressed here?
I'm not sure that food allergies would play a detrimental role in nutrition. I mean, food allergies have to be, I mean, one of the most basic requirements of any parent when they send their child to school is the child be safe. And because more children have been found to have allergies, it's required that certain kinds of foods be restricted in the school environment. And I think that is an example of taking steps to ensure the safety of our children. But I don't see that as being a detrimental effect on educational efforts unless I'm missing something in the question.
Okay, well let's continue and walk through these. Alex, I'd like to ask you, you mentioned Medicaid dollars. What would a school be able to pay for if they were able to access additional expanded Medicaid dollars?
Great question. Thanks, Mark. So what we are specifically looking at is ensuring that really it could be a whole host of services, and it would ultimately be decided at the state level. So we would ask Health and Human Services to provide guidance about potential services. So it could be everything from just general checkups of the children. It could be administering diabetes medication or providing assistance to a student that is learning how to take their asthma medication or manage their asthma. And it could also be for hearing screenings or for vision screening. So I think it's a whole host of services that that could potentially be reimbursed if Medicaid funding is freed up for these issues.
Okay. And how do you see alcohol, tobacco, or other drug prevention efforts fitting into this initiative?
I think it's something that we didn't speak specifically to in Health in Mind, but I think that's something that we are very interested in learning more about as we move forward with our work with the Surgeon General. I think there's been a lot of fantastic work done around those issues and some initiatives that we can certainly learn from as we think about how we can implement additional programs in schools. So as I said, with the Surgeon General issuing the charge to really explore the full potential schools can play in supporting health and wellness, I definitely think that those are issues that we will take up and look to bringing in partners to share the best practices and lessons learned.
Great. Dr. Basch, you mentioned a lack of sleep and the association that has with asthma, but could you address do you have information on sleep needs in general and its effects on learning?
Absolutely. It's a burgeoning area of research. Sleep plays a very powerful effect on our brains and on our brain chemistry. But the important thing to recognize, and I think it's kind of indicative the way the questions have been coming in, very categorical, one on physical activity, we could talk about physical activity, and we could talk about diet and nutrition, and we could talk about sleep. But the key thing to recognize is when you look at these factors individually, they're not likely to have really large or consistent effects across entire populations. In contrast, when you look at the interactive and synergistic effects of multiple factors such as inappropriate nutrition, malnutrition, sedentary lifestyle, and lack of sleep collectively, they begin to really have a very powerful effect on our brains and how our brains are able to focus attention, remember things, make decisions, stay alert and focused. Paying attention is one of the most challenging skills that young people have. And when you're sleep deprived and you're hungry and you're lethargic, it's going to be much more difficult to pay attention and really be fully engaged. If you're interested in the specific neurosciences research, you can go to the original report, which I don't know if you folks can post the report on your website, but that's fine with me. Post that, and you can see the specific research that shows how and why sleep affects brain chemistry and the educational effects on memory and learning and attentiveness and so forth.
So Dr. Basch, were you referring to your research?
No. This is the sleep research is done by neuroscientists and by molecular biologists that have really seen the effects on the brain from sleep deprivation. And my effort has been to simply synthesize what's already known. And now there's very little controversy about any of these points that have been made, that sleep affects learning, that these other health problems and others such as the substance abuses raised affect learning. The key issue now is how to translate that, how to put what we already know into practice. It's not controversial that any of these things have an effect on our mental abilities and some in our social abilities. And our mental and our social abilities also have reciprocal effects. But now what's needed is translating this research, this rigorously conducted research, into action in the nation's schools, and particularly in the nation's schools that have the greatest risk of academic failure, which not coincidentally are the same schools where there's these highest rates of these health disparities.
Okay, great. Thank you. And Dr. Basch, on a related note, there's a question about if there being is there a really good clearinghouse for evidence-based school health programs? You know, do you know of, or do you have any information or ideas of one that the listeners can access?
Yes, I mean that's a great question, and you know it's challenging because there's all these different programs out there, and they have different costs and they have different levels of time commitment, and they've been developed by different audience, people with different kinds of vested interest. I would recommend the CDC Gov site, and then just go to DASH, D-A-S-H, the Division of Adolescent and School Health. I think they have many guidelines posted on their website for everything from tobacco, alcohol, and drug programs to violence prevention programs to teen pregnancy prevention programs to asthma-friendly school programs and so forth. So I'd say that is probably the single best clearinghouse. And then, there are other government websites that you can look at the What Works Clearinghouse, although there's not that many programs in there, and the way the evidence is defined, some people feel is controversial. There's the Substance Abuse and Mental Health Administration, has a registry of evidence-based programs. So there's a variety of clearinghouses, but I personally would recommend the CDC .gov site in the Division of Adolescent and School Health as the most helpful.
Great. Okay. And here's a question, and we're going to probably limit it to 2 more questions based on time, but the questions do keep coming in. Dr. Basch, have you seen any research or information about cost of addressing the health issues that you were mentioning in the school? What would it, are there additional resources that schools need, and what would those resources be?
That's an excellent question, and I'd answer it in 2 ways. First of all, it's important that we recognize there's already a lot of resources being invested in school health. But because the investments are very categorical, because they're not strategically planned in ways to influence academic achievement, because they're too often low quality, and because by and large they tend to be not well coordinated, not effectively coordinated, we are squandering a lot of the resources that we already have, and they're not insignificant. Now, would it be necessary to invest additional resources? Probably in the schools with the greatest needs, where the children are living in families and communities of extreme poverty. Likely that additional resources would be warranted and necessary to fully result in the benefits to youth in the most efficacious way. But we're not talking about, I mean, just to put it in perspective, think about the amount of money we spend in the healthcare system in people's last year of life. And if you do that, you can see that talking about the kinds of prevention services that we're describing here are extremely cost effective.
Okay, great. Thank you so much, Dr. Basch. Now it looks like it's 2 p.m. Eastern Time. I know that, Dr. Basch, you have a very hard stop, so we appreciate you taking the time. For those questions that we didn't get to, we apologize. We'll do our best to review them and see if we can get an answer for you offline. Having said that, please, everyone, stay tuned. We will get an email out to you within the next week, so you have information about about where to access the slides, as well as a copy of this presentation, which you'll be able to download and share with your colleagues. So having said that, I'd like to thank Alex. I'd like to thank Dr. Basch. More importantly, even, I'd like to thank all of you for participating with us. for our friends and our partners at the Trust for America's Health and for Kellogg Foundation for making all of this work possible. Thank you very much, and we look forward to hearing from you and seeing and listening to your questions next time. And have a great afternoon. Take care.